Welcome, and thank you for joining us for today's webinar, Adolescent Vaccines, How Pharmacists Can Make Strong Recommendations and Referrals. My name is Kathleen Amos, and I work at the Public Health Foundation. I am joined by my colleague, Russ Rubin, and we are pleased to be hosting this webinar on behalf of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC. We have two excellent presenters with us for this webinar and are very much looking forward to sharing their presentations with you. As we get started, we would like to go over a few housekeeping items for this webinar. On the slide, you can see an image of the attendee control panel, which you should see on the right side of your computer screen. This control panel is your hub for interacting with the webinar. First, in the control panel, you should see an audio section. You have two options for accessing audio for this webinar: listening through your computer speakers or calling in on a phone. If you are using your computer speakers, please choose the computer audio option. If you're using your phone, please choose the phone call option and enter your audio PIN found in the audio panel. Please make sure to select the audio option you are using, and if you choose to listen over the phone, please also be sure to mute your computer speakers to reduce any echoing. Regardless of which option you choose, all webinar attendees are muted. The slides for today's presentation are available for download in the Handouts section of your control panel. Links included in the slides are not live during the webinar presentation, but are live in the handout. So if you download a copy of the slides, those links will take you to the additional resources. Throughout the webinar, please submit your questions or comments for any of the presenters via the questions box in your control panel. Please feel free to send in your questions at any time, and we will address as many as possible during the Q&A session at the end of the webinar. If you have difficulty with any of the technology for the webinar, please also use the questions box to send us a message, and we will help troubleshoot. And finally, we want to let you know that this webinar is being recorded and the archive will be available following the webinar. Every year in the United States, 33,700 women and men are diagnosed with a cancer caused by human papillomavirus, or HPV, infection. HPV vaccination could prevent more than 90% of these cancers from ever developing. Yet HPV vaccine rates continue to lag behind other vaccines. Only half of U.S. adolescents are up to date. Pharmacists are uniquely positioned to have a positive impact on HPV vaccine delivery, given that on average, a pharmacy is available within 2 miles of every home in the U.S. Pharmacists can identify which vaccines preteens need and motivate parents to make an appointment with their child's doctor to get vaccinated. And in some states, pharmacists can administer HPV vaccine to preteens. During this webinar, we will discuss how pharmacists can make effective HPV vaccine recommendations and referrals, and share effective communication techniques and CDC educational resources for healthcare providers and parents. To share this information, we're joined by two speakers. Suzanne Higginbotham is the director of the Center for Pharmacy Care and Residency Programs at Duquesne University School of Pharmacy in Pittsburgh, Pennsylvania. She completed her PharmD at Duquesne, as well as a 2-year academic and research fellowship with a focus in ambulatory care. Dr. Higginbotham's current areas of research include pharmacist-directed immunization practices, and she teaches advanced pharmacy practice skills, as well as serving as the director of continuing pharmacy education in the School of Pharmacy. Ian Branham is a health communication specialist in the Health Communication Science Office of CDC's National Center for Immunization and Respiratory Diseases, or NCIRD. Ian has supported health communication activities at NCIRD since 2014 and currently leads CDC's HPV Vaccine is Cancer Prevention campaign to increase awareness among clinicians and parents about the importance of HPV vaccination to prevent cancers caused by HPV. Ian earned his master's in journalism and mass communication from the University of Georgia. Both of our presenters today declare no conflicts of interest or financial interest in any product or service mentioned in this activity, including grants, employment, gifts, stock holdings, and honoraria. This live webinar has also been approved for 1 hour of continuing pharmacy education, or CPE credit. To claim CPE credit for the live webinar, participants must be in attendance for the entire activity and complete the evaluation by June 28, 2019. An attendance code and further instructions will be provided at the end of the webinar. This webinar is a live continuing education activity for pharmacists developed by CDC and the American Pharmacists Association, or APHA. And before we dive into the content of the webinar, we have 3 quick polls to help us all get to know a little bit more about who is in the audience today. So I'm going to turn it over now to Russ to take us through those.
Thank you, Kathleen. We just have a few quick questions. So everybody, eyes on your screen and locate your mouse for our first question, which says, what setting do you practice in? Please take a look at the answers and indicate your response and hit the submit button. All right, just a few more seconds. Okay, I'm going to close the poll and share the responses with you. Looks like we have about 40% joining us, not as a pharmacist. We have 27% independent or chain pharmacy, and 22% in a hospital or clinic setting. Thanks for joining us. All right, now let's move on to our second question, which says, are you currently administering HPV vaccine to 11 and 12-year-olds? Please make your response. All right, just a couple more seconds. All right, thank you for your answers. And we're showing 63% not currently administering HPV vaccine to 11 and 12-year-olds. Very helpful information for our presenters today. And our final question is, how comfortable are you discussing HPV vaccine recommendations with parents and or patients? Please make your response. All right, just a couple more moments. I will close the poll and share the responses with you. And it's nice to see that 46% of you are very comfortable discussing recommendations, 42% somewhat comfortable. So Kathleen, I'll turn it back over to you.
Great.
And we'll continue the presentation.
Yes, thank you, Russ, and thank you so much for that feedback. As Russ said, it's very helpful for the presenters as they talk through their presentation. So with that, we are now going to turn the floor over to Suzanne to get us started.
Great, thank you so much, Kathleen. Okay, so I'm going to begin my presentation by talking about my learning objectives. I'm going to discuss the importance of adolescent vaccinations, the role that pharmacists play with regard to vaccinating in this population, along with discussing effective communication strategies for addressing caregiver concerns and making vaccine referrals. So we're going to start with 3 assessment questions that relate back to the learning objectives of the presentation. At the conclusion of my presentation, we will come back to these questions and discuss the answers. So the first question I have is related to a 14-year-old girl presenting to a pharmacy with her mother requesting a follow-up dose of HPV vaccine. She's not currently taking any medications and she's otherwise healthy. She received her first dose 2 months ago, and we're looking at which of the following of these recommendations would be best to recommend for this patient. And you can see the 4 options that you have listed below, and like I said, we're going to come back to this at the end of the presentation. The second assessment question relates to an 11-year-old boy presenting to a pharmacy with his mother. You notice that he hasn't received the HPV vaccine. When you recommend the HPV vaccine for the child, the mother declines due to concerns about the vaccine. So we're looking at which of the following represents the best strategy to address parent concerns. And you can see the responses below. The final assessment question is a 13-year-old boy presenting with his father to receive the HPV vaccine in the pharmacy. You are unable to vaccinate adolescents under the age of 18 in your state. Which of the following represents the best way to refer this patient in order for him to receive the HPV vaccine? And again, we have 4 responses for this question. Okay, so let's begin the presentation by discussing a brief background on HPV and the HPV vaccine. Okay, so approximately 79 million Americans are currently infected with HPV, and about 14 million people become newly infected each year. HPV is so common that most females and males who are sexually active will be infected with at least one type of mucosal HPV at some time in their life, and most will never know that they are infected. Based on data from 2011 to 2015, about 33,700 HPV-associated cancers occur in the United States each year, about 20,000 among women and about 13,000 among men. An HPV attributable cancer is a cancer that is probably caused by HPV. HPV causes nearly all cervical cancers and many cancers of the vagina, vulva, penis, anus, and oropharynx. A CDC study used population-based data from cancer tissue to estimate the percentage of these cancers that are probably caused by HPV. The HPV vaccine protects against cancers caused by HPV infection. Girls and boys 11 or 12 years old should get the recommended series of HPV vaccine. By targeting adolescents, specifically those 15 years of age and younger, 2 doses of the vaccine are needed, 0 and 6 to 12 months apart. If the interval between the 2 doses is less than 5 months, a third dose is recommended. For those receiving the first HPV vaccine dose at 15 years of age or older, a third dose series is needed, 0, 1 to 2 months after the first dose, and 6 months after the first dose. Both the HPV vaccine and cervical screenings are intended to prevent cervical cancer. However, cervical cancer is the only HPV cancer with routine screening. Other cancers may not be detected until they cause major health problems. It is advised that cervical cancer screenings be recommended for women 21 to 65 years of age, and women who have received the HPV vaccine should still be screened for cervical cancer beginning at age 21 in accordance with the currently published cervical cancer screening guidelines. When recommending the HPV vaccine, remember that the vaccine is very safe and the benefits far outweigh any potential risk. As with all vaccines, a severe allergic reaction to a vaccine component or following a prior dose of HPV vaccine is a contraindication to receiving. Bivalent HPV vaccine is also contraindicated in patients with a history of immediate hypersensitivity to yeast. The most common side effects include pain, redness, or swelling at the injection site, and, as with any vaccine, syncope can occur. Recent data suggests that syncopal episodes are more common in adolescents. The HPV vaccine is also very effective. In the 8 years after the first HPV vaccine was recommended in 2006 in the United States, quadrivalent type HPV infections in teen girls decreased by 71% and decreased in young women by 61%. Research has also shown that fewer teens are getting genital warts since HPV vaccines have been in use in the United States. Studies suggest that HPV vaccines offer long-lasting protection against HPV infection and therefore disease caused by HPV infection. Studies of the bivalent and quadrivalent vaccines have followed vaccinated individuals for 8 to 10 years and have found no evidence of protection decreasing over time, and the duration of protection provided by HPV vaccination will continue to be studied. So again, targeting our early adolescent group is key. Vaccinating girls and boys 11 to 12 years old provides protection before potential exposure to the virus and is more effective if given sooner rather than later. Those under the age of 15 need fewer doses than older teens to get the same protection. This now brings us to how pharmacists can play a key role in HPV vaccination. Pharmacists are experts in pharmacotherapy, and our role across all practice settings is to evaluate the safety and effectiveness of medications. As vaccinating pharmacists, we play a critical role in advocating and educating our patients about the HPV vaccine, specifically that the vaccine is safe, effective, and offers a long duration of protection. Working as part of an immunization neighborhood, we play a role in patient and community-focused care. This term, coined by the American Pharmacists Association, is defined as collaboration, coordination, and communication among immunization stakeholders dedicated to meeting the immunization needs of the patient and protecting our community from vaccine-preventable diseases. As immunizing pharmacists, we are able to administer the HPV vaccine in certain states. If you are granted authorization to administer HPV vaccine in your state, have vaccines stocked and readily available for administration. After administering, immediately schedule follow-up dosing for second and third doses. Send reminders for appointments for subsequent dosing and address any parent concerns or with any cost associated with concerns. If you are not granted authorization to administer HPV vaccine in your state, communicate with other providers to ensure follow-up doses are scheduled. This creates an opportunity for us as pharmacists to provide follow-up vaccine doses in an accessible setting for our patients. Being a part of the immunization neighborhood, we should aim to incorporate routine immunization needs assessments, including HPV, into our practice settings. After performing a needs assessment, administer recommended vaccines under state authority and refer to other providers when vaccinating is not an option. Document vaccines given through statewide immunization information systems with primary care providers and with patients. Now let's discuss effective strategies when recommending adolescent vaccines and addressing caregiver vaccine concerns. As previously mentioned, assessing the needed immunizations is the first step to ensuring patients get vaccinated. Pharmacists should perform a needs assessment with every patient encounter, since many parents and children may not know which vaccines they are indicated to receive. Research indicates that a healthcare professional recommendation is the strongest predictor of whether a patient gets vaccinated. Your patient's vaccination needs will change over time based on factors such as age, health condition, lifestyle, travel, and occupation. Utilize the CDC immunization schedule to perform a needs assessment for each patient encounter. Bundle the HPV recommendation with other vaccines and follow up by communicating any education, resources, and reassurance about the vaccine. Address any concerns or barriers to receiving the vaccine. Addressing concerns regarding the HPV vaccine may sometimes be difficult, but it is necessary to facilitate an accurate assessment of any existing barriers. One great approach is to use motivational interviewing techniques. As pharmacists, we want to evoke behavior change talk by asking open-ended questions and using positive affirmations. Guide the conversation by forming reflective statements and acknowledge any concerns. Before providing information about the vaccine, always ask permission to discuss or share information. There are many concerns that a parent or caregiver may have regarding the HPV vaccine, ranging from why is this vaccine needed to what does the vaccine cover. As pharmacists, we can ensure that we address these concerns in an efficient way by first making sure that we feel comfortable with the vaccine's safety, effectiveness, and duration of protection. Second, we can be confident in our abilities to address these concerns with the parents. Know the information about the vaccine and relay it in a supportive way to our patients and our caregivers. Involve pharmacy team members as contributors to vaccine delivery. Even though some team members may not be able to vaccinate, they are able to educate, advocate, and aid in the care coordination process. It is important to train the entire staff on the importance of immunizations, including how to conduct a needs assessment, documentation, workflow, and sending reminder calls and follow-up. Now that we have looked at effective strategies when recommending adolescent vaccines, let's demonstrate strategies for pharmacists to use when making the vaccine referrals. As previously discussed, pharmacists in many states cannot vaccinate adolescents under the age of 18. When this occurs, it is necessary for us to emphasize strong recommendations for adolescents beginning at age 9 through age 26 and refer to another vaccine provider. Communicate and collaborate in a timely and an effective way in order for our patients to get the needed vaccines. When patients present to your practice site with no current medical provider or barriers to access, provide resources on where to obtain the vaccines. Some resources may include private physician practices, community health centers, local or state health departments, and federally funded care centers. When making recommendations, be sure to discuss actionable items with parents and caregivers. This may include where to be seen for the referral, the number of doses needed, and any insurance costs and coverage. Consider sending communication to the provider concerning the recommendation for the specific vaccine. Always follow up by asking if there are any questions or concerns that you can address or any help you can provide along the way. Let's look at this example of a strong recommendation. Hello, Mrs. Smith. It looks like Johnny is due for his first dose of HPV vaccine. I just took my son Chris to his pediatrician to get his second dose. I can't give HPV here today, but he does need to get scheduled for it right away. Can you call his doctor to make an appointment? I can let his doctor know that I spoke with you today. Since Johnny is 11, he will only need 2 doses. What questions can I answer for you? Now that we have walked through effective strategies to address caregivers' concerns and strategies to use when making vaccine referrals, let's practice with a few case studies. So here we have 11-year-old Gia. You are working in your community pharmacy when Gia presents with her mother. As an immunizing pharmacist in your state, you are only authorized to vaccinate adults, 18 years of age and older. However, you have several campaigns in your pharmacy to promote vaccine awareness. Gia is up to date on all of her school-required vaccinations, but she hasn't received the HPV series. Her mother notices the posters, but she comments, "Isn't 11 a little too young to be vaccinating Gia against HPV?" In this case, think about how you would start the conversation with the parent. One suggestion might be, your daughter Gia is 11, and all adolescents 11 or 12 years old should get 2 doses of HPV 6 to 12 months apart. Getting her vaccinated now protects her from cancers caused by HPV. Remember that parents are sometimes very hesitant to vaccinate even when given this information. The vaccine is not required by school, and some parents feel that there is time to wait, so they delay the dosing schedule. There are feelings that it may promote sexual activity earlier in life. For conversations regarding promoting sexual activity in early life, think about this. A study showed that preteens and teens receiving the HPV vaccine did not initiate sexual intercourse at any earlier age than those not receiving the vaccine. I would think about saying something like this. I recommend we give your child her first dose HPV shot today. While she is not sexually active and you may not want to have that conversation at such an early age, it is important for her to be as protected as possible when sexual activity becomes a possibility. I plan to vaccinate my child when she turns 11. Let's now take a look at 12-year-old Tommy. You are working in a community pharmacy and Tommy presents with his father to drop off a prescription. While they wait for the prescription to be filled, you ask the father permission to perform an immunization needs assessment for his child. He agrees and you are able to access the statewide registry and find that Tommy is due for both the HPV and Tdap. You are authorized in your state to vaccinate Tommy in your pharmacy, but the father says, I'm concerned because I've heard that HPV vaccine isn't safe. I also don't know why boys need the vaccine if it protects against cervical cancer. So again, you see here that we've bundled it together, we've performed the immunization needs assessment, but think about again how you would start the conversation in this case. Knowing that the HPV vaccine is very safe and also is indicated for his son, you could say something like, the HPV vaccine has been carefully studied by medical and scientific experts. The vaccine is very effective and very safe. Like other shots, most side effects are mild, with slight pain or redness in the arm. HPV vaccine has not been associated with any long-term side effects. HPV vaccination can help prevent future infections for your son that can lead to cancers of the penis, anus, and back of the throat. In summary, with regards to the HPV vaccine and all vaccines, become an immunization champion. Advocate, educate, and vaccinate on behalf of your patient and your community by discussing the importance of adolescent vaccinations, utilizing effective strategies when recommending and making vaccine referrals and addressing caregiver concerns. Okay, let's go back to our 3 assessment questions and see if we can walk through the answers. We'll go back to our 14-year-old girl presenting to the pharmacy with her mother requesting a follow-up dose of the HPV vaccine. Remember that she's not taking any medications and she is otherwise healthy and received her first dose 2 months ago. So looking at the 4 answer choices, we see A, where you would administer 1 dose now and 1 additional dose 6 months after the first dose. B, we would administer 1 dose now and no additional doses. C, 1 dose 4 months from now. Or D, no additional doses are needed. I'll give you a second to look at those. And we see the answer is C. Since she is in the range of 11 to 15 with no other health conditions, she is indicated to receive 2 doses of HPV, 0 and 6 to 12 months apart, as long as there was no interval between the doses that were within 5 months, so she doesn't need her 3rd dose. Okay, our second assessment question. We have our 11-year-old boy presenting to the pharmacy with his mother. You notice that he hasn't received his HPV vaccine. When you recommend the HPV vaccine for the child, the mother declines due to concerns. So we're looking for the best to address this parental concern. So we have A, acknowledge the parental concern and ask permission to share. B, avoid discussing any information about the vaccine. C, tell her the vaccine is not mandatory so she can wait a few years. Or D, ask the parent why they are against vaccinating. Give you a moment to look. And we see the answer is A. As discussed in the webinar, pharmacists should utilize motivational interviewing techniques to address concerns and ask permission to share information. Of the responses, response A addresses this the best by acknowledging the concern and requesting permission to discuss and share that information. And finally, we have our 13-year-old boy presenting with his father to receive the HPV vaccine in the pharmacy. We are unable to vaccinate the adolescent under the age of 18 in this state. So which of the following represents the best way to refer this patient in order for him to receive the HPV vaccine? So A, explain to the father that you are unable to vaccinate. B, provide information about the HPV vaccine, then refer to the primary care physician. C, utilize a statewide immunization information system to query if he's received them. Or D, refer the father to his insurance company to ensure that the HPV vaccine is covered. And we see here the color change to B. This relates back to strong recommendations. The strongest recommendation was B. It captures the best recommendation by providing information, referring to a vaccinating provider, communicating necessary information to the patient. Even though the other choices may aid the caregiver with information, they don't provide enough information and access to ensure that that patient will become up to date on the needed HPV vaccine. So I will now pass over the presentation to Ian.
Great. And thank you so much for the opportunity to speak with you all today. I'm excited to share some of our HPV vaccine materials. So during the presentation, I'll cover the following objectives. 1, describe effective HPV vaccine recommendations for patients age 11 or 12 years. Identify reassuring, confident, and concise responses to parental questions about HPV vaccination, and locate CDC HPV vaccine resources for healthcare professionals and parents. And before I get into the presentation, we're going to go over 3 assessment questions as part of the CE component of today's webinar. At the end of the presentation, I'll share the answers to these questions. The first question, what percentage of adolescent boys and girls are up to date on their HPV vaccine in the US? A, 25%, B, 49%, C, 60%, and D, 85%. Question 2, what is the top reason that parents cite for not getting the HPV vaccine for their child? A, they believe that HPV-associated cancers are not serious. B, they think the vaccine is too expensive. C, they're concerned about HPV vaccine safety. And D, they are worried about the pain of the shot. And the final assessment question, which of the following is not an effective strategy for recommending HPV vaccine? A, talk about cancer prevention. B, talk about how vaccination is important to prevent a sexually transmitted infection. C, bundle the recommendation with Tdap and meningococcal vaccines. And D, give clear and concise answers to parents' questions. And with that, I'll segue into the presentation. Now, before getting into discussing effective communication practices and highlighting some of our materials, I wanted to show where we are with HPV vaccine coverage rates at the national level. On this slide, you can see a graph that depicts data from our National Immunization Survey team, which looks at vaccination coverage rates for recommended adolescent vaccines. The graph is a little bit confusing to follow, but what I want to draw your attention to are the red and blue lines at the top and how those compare to the aqua line toward the bottom of the screen. As you can see, the Tdap and meningococcal vaccine shown in the red and blue lines are quite high, with Tdap vaccination rates around 89% and meningococcal rates around 85%. However, the rates of adolescents who are up to date on the HPV vaccine, meaning they've received all the recommended doses for their age, is substantially lower at 49%. The important piece that this slide shows is that high coverage rates for Tdap and meningococcal vaccines show that most preteens and teens are getting to the doctor and getting at least one of the recommended adolescent vaccines. So there's a key opportunity to ensure adolescents get the HPV vaccine while they're getting their Tdap and meningococcal vaccines. In this same immunization survey, parents are also asked to cite the reason that they didn't get the HPV vaccine for their child. And while the order is different for parents of girls versus parents of boys, the top 5 reasons are all the same. And these reasons include concerns about safety or side effects from the vaccine isn't needed or necessary, the vaccine wasn't recommended to them, lack of knowledge about the vaccine, and their child isn't sexually active. So if we look at the top 5 reasons, one thing that they all have in common is that healthcare professionals can play a key role in addressing these reasons by following some effective communication practices. And with that, I'll segue into some tips for how to effectively talk with parents about the HPV vaccine. So we mentioned this idea of making an effective recommendation and how that can help increase parental acceptance for the vaccine. Now I'll go into some of the elements of an effective recommendation as well as what it looks like in practice. So here are 3 tips for making effective HPV vaccine recommendations, whether you're referring preteens to another provider or are able to vaccinate yourself. The first tip when making an effective recommendation is to talk about cancer prevention. Research has shown parents want to hear about HPV vaccination in the context of cancer prevention rather than in the context of sexuality. Parents want to hear the bottom line, which is that HPV vaccine can help protect child from cancer. The second tip is to bundle the recommendation with Tdap and meningococcal vaccines, which you've heard touched on a couple times already. When the HPV vaccine is presented as just one of 3 vaccines that kids need to be protected against serious diseases, parents are more likely to accept the recommendation. And lastly, give clear and concise answers to parents' questions. I'll touch on these last 2 tips a bit more in the next couple slides. So now that we've shared some of the elements of an effective recommendation, I'd like to take a second to show what it looks like in practice. So here's an example of what we call the bundled recommendation or a same way, same day recommendation. Now that Sophia is 11, she's due for 3 vaccines. These will help protect her from the infections that can cause meningitis, HPV cancers, and pertussis. Talk to Sophia's doctor about getting these shots, or conversely, we'll give those shots today. A few things about this: it's clear, it's concise, it keeps the focus on cancer prevention, and perhaps most importantly, it places equal weight on all 3 adolescent vaccines and doesn't single out the HPV vaccine or make it seem optional. Now, many parents will accept the bundled recommendation without any questions. Other parents may be interested in vaccinating, yet still have questions. A question from a parent about the HPV vaccine doesn't mean they're refusing or delaying. Many parents are just looking for additional reassurance from you, their child's health provider. Taking the time to listen to parents' questions and understand what their actual concern is can help you save time and give a more effective response. It's really key to make sure that you are addressing the actual concern that the parent has. So it's key to hone in on that when you're talking to parents. Now let's go through some examples of common questions that parents may ask and some tips for how to respond to them. The first question: is my child really at risk for HPV? it's hard for parents to see their 11 to 12-year-old as being at risk for HPV infection, and they may ask about that risk. You can mention how common HPV is and keep the focus on how they have the opportunity to protect their child from certain types of cancer later in life by saying something like, HPV is a very common virus that infects both men and women. We can help protect your child from these cancers by starting the HPV vaccine series today. Asking why now or why at 11 or 12 is another way parents may say that they think their child is too young to get the vaccine, or in other words, their child isn't engaging in sexual activity. Help parents understand the importance of vaccination before exposure and that we don't wait for exposure to occur, just when it will occur before vaccinating. So you can say something like, as with all vaccine preventable diseases, we want to protect your child early. If we start now, that's one less thing we have to worry about. Also, your child will only need 2 shots of the vaccine at this age. If you wait until they're older, they may need 3 shots. Talk to your doctor about getting the vaccine as soon as possible. Or you can say, if you're able to administer vaccines in your pharmacy, get the first shot today, and then you'll bring your child back in 6 to 12 months for the second shot. Now, naturally, some parents will have questions about HPV vaccine safety. One question we often hear is, I read something online that says the vaccine isn't safe. Do you really know it's safe? So you could start off with something like, it's like you want what's best for your child and have concerns about the safety of the HPV vaccine. Is that right? We both want best for your child. So starting off on that common ground that you, like the parent, has their child's interest in mind is key to building trust. And then you can focus on asking them to elaborate on what their actual concerns are and asking permission to share what you have learned. So when you have that understanding of what the parent's concern is, you can share that, that specific information to address that concern. Now, these are just a few questions that you may receive. Next, I'll share some resources with you that can help you identify additional questions as well as some responses. So this handout, which is called Talking to Parents About the HPV Vaccine, provides concise answers to many common questions that you may hear from parents, ranging from why does my kid need it at such a young age to why do boys need it to can HPV vaccine lead to problems with infertility? And so on this slide, you can see an image of the handout that you can print out and share with your staff. The link at the bottom of this slide will direct you to a mobile-friendly webpage that also displays these questions and responses. And you can also find a link to the printable PDF depicted on this slide at that same link. We also do a lot of audience research with both parents and healthcare providers. And one thing that we've found in research with healthcare professionals is that many of them are not aware of the full scope of disease caused by HPV, or that there are no recommended screening tests for 5 of the 6 cancers that HPV causes. So these cancers may not be detected until they cause health problems. So to address that, we created an infographic to help educate healthcare providers and their staff about the large number of cancers that can be prevented by the HPV vaccine. And using an iceberg analogy, the graphic shows that cervical cancer is just the tip of the iceberg, and that there's a large burden of cervical precancers, as well as 5 other types of cancers that HPV causes every year. This infographic also reminds providers there are no recommended screening tests for these other types of cancers, which is why on-time HPV vaccination is so important. And you can find the link to the printable PDF at the link below. Also know that how important advice from peers can play. So CDC has also developed a video series called How I Recommend, which features short videos of practicing clinicians sharing their tips on how they recommend HPV vaccine and answer common questions in their practice. So these videos feature pediatricians, family physicians, and nurse practitioners addressing questions ranging from how do they make the recommendation to how do you address questions about safety to how do you address parental refusal. You can find these videos on the CDC website at the URL listed on this slide, and they're also available on YouTube. We also have a range of fact sheets and articles providing clinical guidance to healthcare providers, as you can see from these 3 examples. The fact sheet on the left is called Top 10 Tips for HPV Vaccination Success. It's geared towards physicians, but some of the tips are also relevant for pharmacists. And the fact sheet in the middle provides a summary of HPV vaccine recommendations and background on the disease. And the fact sheet on the right provides some guidance on deciding how to determine whether a patient needs 2 or 3 doses of the vaccine. We have several other resources as well, which are housed on a webpage listed here. Additionally, last year we developed a new CE activity titled HPV vaccination at 11 to 12 as a standard of care. It's available as a web-based on-demand video, and it features 4 practicing physicians discussing how they ensure they meet the standard of care by making effective HPV vaccine recommendations, and as well as how they answer parents' most common questions. Pharmacists can receive contact hours in pharmacy education, and the CE credit is available until January 2020. And you can find a link to this activity at the URL on this slide. We also have a number of materials available to share with parents, both digitally and in hard copy. So these include fact sheets about the HPV vaccine and HPV vaccine safety and effectiveness, because we know that when parents have concerns about HPV vaccine safety, it can also include questions about how well the vaccine works or how long the protection of the vaccine lasts. We also have an infographic called 6 Reasons to Get the HPV Vaccine for Your Child, available in both a digital format as well as a printable format, which features some visuals for a number of compelling reasons that parents should get the vaccine for their child. And then also on this slide, you can see a visual of our parent-friendly immunization schedule that you can share with parents to educate them on the vaccines that their kid needs based on their age. And the last resource I wanted to share is a template letter that we've developed that can be really tailored and adapted for any provider to send out to parents, basically just to remind them about scheduling an appointment for their child to get up to date on recommended vaccines, and includes information on each of the vaccines recommended for adolescents. And it also includes some language that that can be tailored based on if you're sending it out during the back to school season, or if you or what type of healthcare professional you are. Now, before I close with our assessment question, I just wanted to share a couple quick updates. As there have been a number of measles cases and outbreaks this year, I just wanted to take the opportunity to mention the Measles Outbreak Communications Toolkit that our center has developed. These toolkits include a number of resources to assist you in educating parents in your community about the importance of vaccination to prevent measles. And you can find a link to the toolkits, a link on this slide. Lastly, I just wanted to share that National Immunization Awareness Month, or NIAM, is coming up in August. NIAM is really a key opportunity to promote vaccination across the lifespan. We are well underway in our planning for NIAM this year, and I just wanted to share a few quick updates on some of the changes for this year. First, if you've participated in this observance in the past, you're likely familiar with how each week has been structured to focus on the importance of vaccination for a different stage of the lifespan each week. This year we'll be changing the structure a bit so that we'll actually be focusing on a few overarching messages to be used throughout the month rather than focusing on a different audience each week. And these overarching messages will also be adapted for various audiences, and which should provide you some flexibility to structure your communications as you see fit. Additionally, working on developing a more streamlined digital communication toolkit that will live on the CDC website. And finally, we know how important graphics are for developing engaging social media content. So we're rebranding the NIAM graphics to include graphics for various social media platforms. So stay tuned for more updates on this. And now to go back to our assessment questions that we began with, the first question was, what percentage of adolescent boys and girls are up to date on their HPV vaccine in the US? If you recall from that initial slide, from one of the initial slides of the graph showing vaccination coverage, the percentage of adolescent boys and girls who are up to date on the vaccine is about 49%. Second question, what is the top reason that parents cite for not getting the HPV vaccine for their child? The choices were they believe that the HPV-associated cancer is not serious, they think the vaccine is too expensive, they're worried about the pain of the shot, and the correct answer was that they are concerned about HPV vaccine safety. If you recall, this was one of the top 5 reasons that parents cited for not getting the vaccine for their child. And finally, which of the following is not an effective strategy for recommending HPV vaccine? So the answer choice was, the correct answer was talk about how vaccination is important to prevent a sexually transmitted infection. So what we've seen is that parents really want to hear that HPV vaccination is cancer prevention. So really keep the focus on that. And also bundling the recommendation with Tdap and meningococcal vaccines and giving clear and concise answers to parents' questions were also effective strategies. And with that, I'll turn back over to the hosts.
Great, thank you so much, Ian. We do have a little bit of time, about 10 minutes or so, left in the webinar for a question and answer period. So thank you both for those great presentations. People have been sending questions in through the questions box. Please continue to do that, and we'll share those questions with the presenters and address as many as possible before we get off the webinar today. So to start us off, Suzanne, I believe this is a question for you.
Okay.
We have a question about, do you know how many states are now allowing pharmacists to vaccinate?
So all of the states in general vaccinating, or just with HPV, I don't know what they're asking, but I can kind of, all 50 states allow pharmacists to vaccinate in some capacity, but there are states that limit the age ranges of which pharmacists are allowed to vaccinate. So 48 states allow pharmacists to administer HPV vaccine either by prescription or standing order, and out of those, 23 states do not have an age limit. So in those states regarding HPV specifically or others to vaccinate those adolescents, 23 of them would be allowed at a lower than 18 age limit.
Great. We have a handful of questions related to the vaccine itself. One being, are there 2 different kinds of HPV vaccine? What are the differences, and when would you use one over the other, for example?
Ian, do you want to take that one, or do you want me to answer?
Yeah, I can take that one. So there are currently 3 HPV vaccines licensed in the US, but there's the non-valent vaccine is the only vaccine that's currently sold and used in the US.
Excellent. And we have a number of people writing in to share their experiences of vaccinating in their state.
Oh, that's wonderful.
Yeah. Another question, do retail pharmacies take vaccines for children program? For example, if a child got their first dose at a community health clinic, could they go to their local pharmacy for the second dose?
I believe, I'm not 100% sure about that one, but if they have the authority to vaccinate, they should be able to, I believe, but I'm not 100% sure about that one. Ian, would you know?
I don't. That's something that our immunization division would have a better response to. So we can certainly follow up on that question.
Great, absolutely. We can definitely do that. Is the vaccine effective if the teen has already been exposed to HPV?
Sure, I can handle that one. So the vaccine is effective, is recommended to be given prior to exposure to HPV. If they were exposed to one of the types that wasn't that wasn't targeted by the vaccine, then the vaccine would protect against whatever types they haven't been exposed to.
Great. We have a similar question, or along the same lines, about why shouldn't older people get the HPV vaccine? Say people in age 40 to 60 age group, wouldn't they have some benefit from strains they might not have been exposed to? So I think that hits on both of those. Can the HPV vaccine be administered along with other vaccines?
Yes. So you can administer multiple vaccines in one day, and as Ian and I both talked about, the bundling of vaccinations can occur. You're not going to overload your immunization, your system in any way, and we've given multiple vaccines on one day.
Great. And then in terms of, you mentioned that several doses are required, and that's different depending on the age group. Will the series of doses need to be restarted if a child misses the recommendation window for the second or third dose?
You would not restart a dosing series. It would just be a delay in protection for the full protection of either the 2-dose or the 3-dose series, depending on age.
Perfect. Great. Does the HPV vaccine prevent the sexually transmitted disease itself, or just the cancer associated with it? Another question that's come in.
Do you want me to handle that, Suzanne?
Go ahead, Ian, if you want.
Sure. Yeah, so the vaccine protects against the HPV infection, the types of HPV that most commonly cause cancer. So it protects against those types that then would lead to those types of cancer. So it protects against the infection and down the road the cancer.
Excellent. And someone has a comment about some providers are mentioning how the HPV vaccine is opening up the risk for other HPV infections or cancers not covered by the vaccine. Therefore, they do not offer it. How would you respond to that? Do you have any advice for the person who asked that question?
I'm not sure I understand. So they're saying that by giving the HPV vaccine, they're opening up the risk for other vaccinations. So if we're basically decreasing the risk for the vaccination, or decreasing the risk for the ones that are covered. Is that what they're asking?
That is the comment.
I'm not sure if you have any data, Ian, for if there's been an uprise of any other serotypes or cancers from the CDC as a result of vaccination, or?
I mean, I think what we've seen is that since the vaccine has been introduced, the types of infections that the vaccine targets have gone down significantly. So within 8 years since the vaccine was introduced, saw a 71% drop in the vaccine type infections among teen girls and 61% among young women. I'm not aware of any data that's shown increases in those other types of cancer of infections, but we can certainly follow up on that.
Okay, yeah. And do you have any advice for how to address if someone raises that issue, raises that concern?
I mean, I think that the the important point is that the types of infections that are causing most of these cancers has gone down significantly. So what we're seeing with the vaccine is they're making a significant impact on the most common types of cancer-causing infections. And we've also seen data showing that cervical precancers that have been linked to these to the two most common types, the proportion of those has gone down as well since the vaccine has been introduced.
Okay, perfect. We probably have time for just another question or two, although please continue to send those in to us. Ian, this might be a question for you. Do you have any examples that you could share of successful vaccination campaigns or pharmacist work going on in rural areas of the country?
I don't know of any specific examples of pharmacy campaign in rural areas, but that's definitely an area that we're very interested in. The thing that I didn't touch on when I talked about the coverage rates is that we've actually seen a disparity in vaccination rates in rural areas. It's actually where fewer adolescents in rural areas are getting the HPV vaccine and the meningococcal vaccines compared to teens in urban areas. And we know that there are fewer pediatricians in rural areas, and so I think pharmacists definitely can play a key role in educating and, where applicable, administering vaccines in rural areas. So that's definitely an area we're interested in, but I don't know of any specific examples off the top of my head.
Okay, thank you. I'll address one question really quick. A couple people asked about the number given for cancers caused by HPV, and I think I covered that in the introduction as 33,700 in the United States. So that's great. Thank you so much for all your questions. As I mentioned, please continue to send those in. We wanted to make sure, though, before the top of the hour, we got you the information for the CPE credit for anyone who is interested in that. So thank you so much for your participation today. If you are interested in claiming CPE credit for this live event, the link shown on the slide here will allow you to do that. And I think Russ is putting that in the chat box as well. So you should be able to pull it from there. It's also in the handouts if you download that set of slides. So you'll have it. One thing we wanted to mention is that the APHA system is actually down for upgrades this week. So access to claim credit will not be available until June 3rd. Beginning on June 3rd, please visit that link to complete the evaluation questions and claim credit using the instructions shown on the slide here. So you would add the event to your cart, log in, create an account, enroll. Under activities, open the window, enter the attendance code, which I will give you in just a second, and click submit, complete the evaluation to claim your credit. We'll also send an email reminder, I know because there's a little bit of a delay here. We'll send a reminder on June 3rd with this information, so you have it handy. So the attendance code for this live webinar is TRCHLR. You can see it on the slide there. To obtain CPE credit for this activity, you are required to actively participate in the entire webinar and enter that attendance code to verify your attendance. So please make a note and retain this code, as it will not be available after the webinar ends. And your CPE must be filed by June 28th, so you have a month to claim credit for this live activity. So with that, we'd like to thank you all once again for joining us for this very informative webinar. Thank you, Ian and Suzanne, for the great presentation. We hope you all enjoyed the webinar as well. As we mentioned at the beginning, we have recorded the webinar today, and an archive will be available on the Public Health Foundation's website. A link to that archive will be emailed to you as soon as it is available, and you will also be able to access the archive from www.phf.org/immunization once it is posted. In addition, from that page, you'll be able to access the slides from today's webinar, as well as archives of other recent immunization webinars in the series. So we will leave the webinar system open for the next few minutes. Please do continue to share with us any questions or comments that you have through the questions box, or you can reach out to us, get in touch with us following the webinar at immunization@phf.org. Thank you once again, and I hope you all have a great rest of your day.